Introduction to typhoid. Typhoid fever is a serious infection caused by the bacteria Salmonella typhi. It primarily affects the digestive system and can spread to other parts of the body. The disease is most commonly found in areas with poor sanitation, contaminated water, or food. Without prompt treatment, it can lead to serious complications, but it is preventable and treatable with the right medical care. Symptoms of typhoid. Symptoms of typhoid usually appear 1 to 3 weeks after infection and can vary in severity. The main symptoms include 1. High fever, often rising to 103 to 104 degrees Fahrenheit. 2. Weakness and fatigue. Patients often feel extremely tired and weak. 3. Stomach issues. Abdominal pain. Diarrhea or constipation, more common in children. Nausea and vomiting in some cases. 4. Headaches. 5. Loss of appetite. 6. Rash. A characteristic rash with flat, rose-colored spots may appear on the chest or abdomen. 7. Enlarged spleen or liver in more severe cases. If left untreated, it can lead to more severe symptoms such as intestinal bleeding or perforation, which can be life-threatening. Causes of typhoid. Typhoid fever is caused by the bacterium Salmonella typhi. The bacteria are primarily transmitted through contaminated food and water, ingesting food or drinks that have been contaminated with the bacteria. Fecal-oral transmission. The bacteria can spread through direct contact with someone who is infected, particularly if proper hand hygiene is not maintained. Asymptomatic carriers. Some people can carry the bacteria without showing symptoms and can still spread it to others. Treatment for typhoid. Treatment for typhoid fever typically involves antibiotics to kill the Salmonella typhi bacteria. Common antibiotics include ciprofloxacin or ofloxacin for non-pregnant adults, azithromycin for resistant strains, ceftriaxone for severe or complicated cases. It is essential to complete the entire course of antibiotics to avoid the risk of relapse or antibiotic resistance. In addition to antibiotics, the patient should stay hydrated by drinking fluids or receiving 4 fluids if necessary. Rest and eat a nutritious diet. In rare cases where complications occur, like intestinal perforation, surgery may be required. Prevention of typhoid. Preventing typhoid fever mainly involves good hygiene and vaccination, especially in areas where typhoid is common. Key prevention steps include 1. Vaccination. 2 vaccines are available, an injectable vaccine and an oral vaccine. Vaccination is recommended for people traveling to areas where typhoid is prevalent. 2. Safe food and water practices. Drink bottled or boiled water. Avoid raw vegetables and fruits that may have been washed with unsafe water. Eat foods that are properly cooked and still hot. 3. Good hygiene. Wash hands frequently with soap and water, especially after using the bathroom and before eating. Avoid close contact with infected individuals or their belongings. 4. Sanitation. Improving sanitation infrastructure, such as clean water supplies and sewage disposal, is crucial for long-term prevention in affected areas. Other details. Complications. If left untreated, typhoid can cause severe complications, including intestinal perforation or bleeding. This can lead to peritonitis, a life-threatening infection. Sepsis. Infection spreads throughout the bloodstream. Pneumonia, kidney failure, or heart infections. Chronic carriers. Some people may become chronic carriers of the bacteria, meaning they continue to carry and shed Salmonella typhi even after recovering from the illness, without showing symptoms themselves. These carriers can spread the infection to others. Typhoid versus paratyphoid. Paratyphoid fever is a similar illness caused by Salmonella paratyphi. It has milder symptoms, but can still pose a health risk. Treatment and prevention methods are generally the same as for typhoid fever. In summary, typhoid fever is a serious disease that can be fatal if untreated. However, with good hygiene, vaccination, and proper medical treatment, the spread and effects of the disease can be significantly reduced. Introduction to typhoid. Typhoid fever is a serious